do apologize. We were just ironing out a few issues, and I'll go straight into the statement. So this is a statement from the Ministry of Health on an update on coronavirus in the country and the response measures as at 26th March 2020. Fellow Kenyans, welcome to the daily updates on the current status of corona disease outbreak in Kenya. In the last 24 hours, a total of 74 samples from suspected cases of coronavirus have been tested in various laboratories, namely the National Influenza Center, KEMRI Nairobi, KEMRI Wellcome Trust Kilifi. Out of the 74 samples, we have received confirmation of 3 people who have tested positive for coronavirus disease. This brings the total number of confirmed COVID-19 cases in Kenya to 31. These 31 confirmed cases are spread out in 5 counties, namely Nairobi, Kajiado, Mombasa, Kilifi, and Kwale. All the 3 new confirmed cases are Kenyans, females aged between 30 years and 61 years. The 3 cases are close contacts of previously confirmed cases. 2 are from Kilifi and 1 from Nairobi. The new patients have already been taken into isolation in our facilities and are being monitored by our medical personnel together with others who previously turned positive. Tracing of contacts for the new patients as well as those of the previous patients is ongoing. The total number of close contacts that we have so far stands at 1,029. Out of this number, 123 of them have been discharged after completing the 14-day follow-up period. We are now remaining with 906 close contacts that our contact tracing teams are monitoring. 18 individuals are currently admitted at Mbagathi Hospital awaiting tests. As we speak, there are consultations going on how our teams are going to handle Kilifi and other areas that are emerging as hotspots. I therefore urge people at the coast and Kilifi counties in particular to observe social distancing with self-determination. Yesterday, the Cabinet Secretary held a meeting with religious leaders in the country who promised to carry out messages of hygiene as well as providing hope for Kenyans during this coronavirus pandemic. The Ministry of Health remains grateful to the religious leaders for their quick response in terms of how they will be willing to collaborate with the government for the good of our people during this crisis. We have assured them the support of the government. There are more than 2,000 people who arrived in the country from Monday this week, and we have placed them under mandatory quarantine. These individuals shall be in due time in line with guidance from the World Health Organization. As we indicated this week, effective last night at midnight, we have closed Jomo Kenyatta International Airport for all international flights. However, as earlier explained, in the event that there are countries who would like to evacuate their nationals from Kenya, this will be handled through the Ministry of Foreign Affairs. Once again, we would like to appeal to our fellow Kenyans to continue supporting the measures placed by the government to deal with this pandemic, as it is the only way that we can cut off transmission of this virus in our country. I thank you all.
My name is Stephen Leto from Citizen TV. I have very few questions. There was a dawn to dusk, dusk to dawn curfew that was imposed yesterday by President Uhuru Kenyatta. What imposed a night curfew as opposed to a day one having that the ministry had already shut down major night activities like clubbing. And number two, there are private clinics already that have begun offering tests for they're calling drive-through test for COVID-19. Has the ministry approved the same? And the last is concerning the patient that was released yesterday as to have recovered. Can she transmit, or can she be reinfected again after she gets out there? And what are the medicine that has been used to cure her and have her released? Thank you. Please ask one question. Just can give us a chance.
Asante. Jina langu ni Waweru Nyambura kutoka Inoro TV. Ningependa kujua serikali imeridhika vipi na mpango wa self quarantine. Ukiangalia kwa kufikia sasa kuna watu ambao wamekuwa wakikiuka sheria na masharti ya self quarantine, na kuna mpango ya kutupilia na anyone who is under that program alete kwa serikali ili monitoring ikuwe ikifanywa na serikali.
Maybe in the last few minutes from another country where the governor did confirm one case. Maybe I don't know whether you are aware of it and whether the county governors are in a position to declare or maybe to confirm the coronavirus cases.
Right, I think we'll take that set of questions, and I'll start with the question on the curfew, and then the Director General will come in and answer the question with the patient that was released. So concerning the curfew, indeed, the President put in place a curfew, and this curfew is a measure of strengthening the messages that we've been relaying to the public. Social distancing, ensuring that physical distancing is our first guard as a weapon. Why this was needed and why this was needed to be emphasized is because we've noticed, despite putting in place instructions, Kenyans have not been adhering to this. We have reports coming in that people are still congregating in clubs, in restaurants. We have reports coming in that people are holding house parties. That is still not social distancing. So now we've put in place this instruction and this directive that will be able to actually help us all implement the physical and social distancing. That is the weapon against corona. The DG can speak to the patient that was released.
Thank you, Madam CS. The patient who was released is case number 2, who had been admitted to Mbagathi Isolation Unit, and we follow the WHO approved protocols which require that we do serial tests until we have 2 consecutive negative tests, and therefore the patient met that criteria after having 2 negative tests. Potentially, of course, reinfection is possible if you come into contact with another COVID case. So even if you are released from treatment or from quarantine, you are still required to follow the infection prevention control measures just like any other person. And let me also take this opportunity probably also to address the issue of Kakamega. Yes, we have had reports that the governor of Kakamega indicated that they have reported a positive case. The case that was reported by the governor is actually a case that is currently admitted at Mbagathi Isolation Center. And the fact that this gentleman comes from Kakamega County, I think that is why Kakamega decided to report. But we want to appeal to the county governments that we have one central reporting system so that we are consistent throughout our reporting in line with WHO requirements. Thank you.
Thank you, DG. There's one more question that was raised concerning the testing that's happening in the private laboratories. I'm informed by the team that laboratory is accredited for testing. However, we're in discussions with that team as to how that can be conducted. So we'll be able to share with you further on the labs that will continue to provide this in terms of private testing. Right, so there's a question on self-quarantine. Again, we're reviewing this. I think you noticed that we instituted mandatory quarantine for all incoming passengers from international flights. What we're going to need to observe is as the situation progresses and becomes more dire, we will require Kenyans to actually observe self-quarantine. We are now in the process of developing and strengthening how the oversight of self-quarantine will look like and how we can adopt a multi-agency approach in ensuring that Kenyans Kenyans who are put under self-quarantine are actually adhering to it. So I think